Hello viewers, I'm Zahur Islam. You are watching me on my YouTube channels. So today we will talk about the disorders of the gastrointestinal tract. So let's take a start from the diarrhea. So diarrhea is one of the disorder of the gastrointestinal tract. So diarrhea means passing frequent loose watery stools 3 or more times in a day. So as we know that diarrhea is often accompanied by vomiting and it is very common in children. The commonest cause in this age group is viral. So there is therefore usually no need to prescribe antibiotics. Fluid loss occurs quickly in the children because of their size. If this is not corrected, so it may result in dehydration, so which can be fatal. In children, other disease like malaria, pneumonia, ear infections, urinary tract infections, it may cause diarrhea. Examine the child fully to make sure there is no obvious cause for the diarrhea. The presence of the fever usually indicates an underlying cause. Never take the complaint of diarrhea lightly. So always ask how many times that day and the day before the patient has been to the toilet and the texture of the stools. To one person who usually passes stool once in 3 days. Emotion every day seems like diarrhea, but to another person this is normal. Giving antibiotics may cause or prolong the diarrhea except in special circumstances. Malnutrition causes diarrhea, which is in turn also called malnutrition, setting up a vicious cycle. Never give enemas or laxative to the patient with diarrhea. So it need very full attention. For example, if someone is suffering from diarrhea, so kindly directly consult to the physicians. So let's come toward the etiology. What are the causing factor? What are the different causes of diarrhea? So it may be virals. For example, rotavirus. The diarrhea, it may be bacterials. Bacterials, it may be due to genus Shigella, like dysentery. The bacteria may be protozoals. For example, amoeba is also one of the main cause. Shigella is also one of the bacterial cause. And rotavirus, this is the viral cause. Side effects of some medication, for example, penicillin. Sometimes diarrheas occur due to use of certain drugs. So like penicillins, beta-lactam antibiotics. So the signs symptoms which are reported after infections of diarrhea, there is frequent watery stools, blood or mucus in the stool, and presence of fever, mean high temperature, reduced urine output, and associated vomiting. So these are the sign symptom, or these are the symptoms which is related with the diarrhea. What are the signs? So signs are actually dehydrations. The following you can check this table and with the degree of dehydration and the children with diarrhea. So as we know that okay, let's see the assessment of the degree of dehydration in children with diarrhea. So first of all, you will have to look at the condition, the eye condition, tears, mouth and tongue and thirst. So the condition of the condition is lethargic or unconscious, that is fluffy. And eyes, they are very sunken and dry, and tears, they are completely absent. The mouth and tongue is very dry, and thirst. Drink poorly or not able to drink. There is restless and irritables. The eyes, if they are sunken, the tears are absent. Mouth and tongue, that is dry. Thirsty, drinks eagerly. If the so I mean these are the different parameters you will have to check that either the patient is lethargic, either the patient is restless or irritable, or that is well alerts. If the eyes and eyes very sunken and dry, sunken in normals. The second one is feel. So feel means skin. Skin go back very slowly after pinching, goes back slowly after pinching, and goes back quickly after pinching. So this is the then decide if the patient has two or more sign, including at least one underlying sign, there is severe dehydration. If the patient has two or more sign, including the at least one underlying sign, there is some dehydration. The patient has no sign of dehydration. Treatment plan is wet the patient and use the plan C. So we will discuss all these things in detail. Now look at the dehydration percentage. So in severe condition, the patient is severely dehydrated. He or she lost more and more fluid from her body or his body. That is greater than 10%, while in mild to moderate, the fluid loss or dehydration is 5 to 10%, while if it is less than 5%, then I think there is no need to start rehydrations. Okay, so in adults and children older than 5 years of old, other signs of severe dehydration that may be present or absent. The radial pulse and the blood pressure is low down, so low blood pressure. The skin pinch may be less useful in the patient with marasmus, severe wasting or kwashiorkor, severe malnutrition with edema or obese patient. Tears are the relevant signs only for infant and young children. So how you will investigate it? So the simple investigation is full blood count. You will have to perform the full blood count and blood film for the malarial parasites. Stool routine examination is very important. Stool for culture and sensitivity is also one of the important investigation. So blood urea and creatinine should be checked down. Now, if the diarrhea present with vomiting, low-grade fever with no mucus and stool, so think of viral infection. So, I think this is very important to know about the if the diarrhea present with vomiting, it means that a patient is suffering from diarrhea with vomiting and low-grade fever with no mucus and stool. So, let's think of viral infection. If the diarrhea present within vomitings and then abdominal cramps and the blood and mucus in the stool with fever, then this is bacterial infection. If diarrhea present with blood and mucus in stool with no fever, think of amoebiasis. If profuse diarrhea present, rice, water, stool, so with vomiting, think of cholera, Vibrio comma. Have diarrhea present with excessive vomiting, especially if and more than one member of household are group thing of food poisoning. So these are the different cases. So you will have to report the case according to the condition of the patient. So inshallah in my next lecture we will talk about the treatment protocol for the diarrhea. So thank you so much for watching my lectures.